The first question I'll put to our panel is how can we move beyond token seats at the table to ensure that community is actually holding the pen or has power when it comes to not just project design and implementation, but budget design and implementation? And Kate, why don't we start with you?
Sure. Thank you so much for this opportunity to speak and be part of today's event. It's a really wonderful opportunity. Thank you. Um, yeah, so if I could dive in here, I want to go back to the idea of asset-based. Part of Salima's point was to talk about the community-based initiatives and how the point is not to replace them, it is to strengthen them. So I think when we talk about the idea of having a pen on the decision-making point, it is about strengthening those local initiatives. Um, and I think just to talk about what asset based looks like when we want to scale, it's not necessarily about taking an idea and then it's out of the hands. There needs to be a feedback loop between grassroots initiatives where we may be seeing incredible outcomes from those projects and keeping them in the loop in a structure that allows for an evaluative cycle. And Rosa, you may have some opinions on that.
Yeah, and just to build off of what you've highlighted. So I think, we have siloing. And if you look at siloing in terms of settlement services, employment services, health services, primary care, it's just if you had a house, it's like many rooms and many walls. But at the end of the day, it's one house. And I think when we talk about the how, some of the things I think are challenges and opportunities is to look at governance. At the end of the day, you have researchers like myself who do the research. And then you have settlement services and newcomer facing community services that actually are doing the work, who are out there and doing all the evidence-backed ways. And then we have, these interchanges where we have, and the evidence is not new. The evidence has been around, I would say, pushing 45 years. And so we're really at a crossroads where, we're even beyond evidence to action. It's actioned. Community-based services and are actioning the evidence. Now what we need is how do we build towards sustaining? And I think the key to this is governance. I think the theme is if community-based organizations and the collective kind of researchers and people in this space are not at the tables. And I would say community-based agencies and newcomers themselves are at tables where decisions about funding happen, decisions about sustainability. And I think many of us have highlighted project-based fundings. A lot of pilot funding, right? We have funding for 12 months to do this, and then after 12 months, what happens? In reality, what happens is settlement-based services, small, very not-for-profit, grassroots, community-based service continue the work without that piece. And so governance, I would say, shared governance. What does that mean? Well, we have to move away from current structures. Advisory boards are wonderful. Partnerships are great. Co-creation is great. But at the end of the day, what happens after 12 months of funding? What happens when you have to provide services by being funded through multiple funders? So social services, Immigration Canada, health services, and you're one agency cobbling multiple funding and you don't have research capacity. So then you partner with researchers. But at the end of the day, that's not sustainable when you're not at the table where governance decisions about operations and sustainability are being made. And so I think the time is now because there's a place of flexibility and awareness. I think our provincial governments, everyone, it is open and understands the power of, centering community-based organizations. I think the lever to that is governance. So not just advisory, not just partnering, but how about having some say on sustained funding and implementing? Um, and data sovereignty. I think this is, we don't talk about data sovereignty. Oftentimes, as a researcher, we partner with community-based organizations and then we do research together. But quite honestly, the structures of academia go through a research ethics board. And then at the end of the day, that data is who owns that? Who gets to do decisions and meaningful ways of retaining that. So I think, data sovereignty, what does that look like when we shift power to community-based organizations that are actually doing the work? Governance in terms of funding and sustainability, when you shift power to settlement agencies. I think when we start to sort that out, we can actually have a newcomer health plan that is not siloed.
I want to,
And Rosa,
oh, go ahead, Kate.
yeah, I was just going to pick up on something that Rosa mentioned, which is this like the house, right, with many walls. I think one of the issues around governance is the role of data and evidence, and to engage in long-term funding and to engage in policy levers. Uh, so putting my sort of systems design hat on a little bit, um, it requires us to be able to speak the language and tell the story in a way that is acceptable to policymakers and government structures. So telling the story, whose story is it? It's the story that resides with those initiatives. So I think part of the shift that needs to happen is for the layer that may be represented by myself and others in the sort of academic practice layer where we're doing practice, but we're also academics, is to shift the lens to how do we facilitate telling the story. And that looks like co-design and systems design techniques. And I think there's a real role for that translation piece. Um, that's and I think it speaks to the governance question. There are groups already in place who are doing incredible work, who have their own governance structures that have developed them. I'm thinking about the local immigration partnerships in particular. They've developed a decision-making and prioritization mechanism within their groups that has developed organically. And we can also learn from those. If we want to scale governance and decision making, we can look at those models that have been developed at the grassroots and see where we might be able to provide capacity building tools to other groups in order to sort of propagate those models. So in some ways, it's also doing the work that there isn't a person for, right? There's, if you're running a local group and you're probably on short-term funding, you may not have the capacity to take the step back and say, how does governance work for other organizations? So I think there's a big role here for the sort of not necessarily pure research layer, but I think there's a definite role here for learning from finding a structure to learn from different groups in order to provide opportunities for capacity building.
And I love that kind of systems perspective because I think the context, if we look at organizations like Access Alliance, which is part of two really big Ontario health teams in the GTA, along with many other social services and grassroots, I would say grassroots because they provide service directly to vulnerable people living in the communities of Toronto. From a system perspective, I feel like that is one of the secret sauces of being at the table, right? And so a lot of people struggle, like, how is the OHT different from the former LINs? And I think there's similarities, right? But I think if I were to point to one major difference between the local health integration networks of past and the current OHTs is that the OHTs have agencies like Access Alliance and the neighborhood organization and hopefully in future settlement services and in future I would call third space organizations, social services. Um, where this kind of direct engagement with people who we're trying to reach are there. So kind of I think this is why I say it's like an opening towards that governance question. How are population-based initiatives funded? If you look at population health from a locally driven perspective, that includes newcomers, all people, all of us. And so this is a discourse change where it's not looking at newcomers as a discrete group of people, of outsiders, but leaning in that actually from a population health, neighborhood, kind of locally driven health perspective, the health of everyone in my community matters. And data shows we have newcomers, and who is a newcomer and for how long? And people don't arrive as newcomers as single entities. They come with families and partners and build a fabric of the community. And so I think that next level, this kind of integration, yes, comes with, the evidence and all the things we know, but, really changing the structures. I use the OHT as an opportunity when these groups and organizations could be there, but then we're not quite there yet, right? At the end of the day, we have to ensure that folks have equal decision-making authority when OHTs are funded for programs and initiatives, that though the decision-making process is power shared, because there is power inequities, right? In terms of size of organization and, you know, reputation and whatnot. And so, but it's a fine nudge, and we have a window of opportunity, and there is real tension. Those windows could close, right? And there's also tension of tokenism. And the tokenism is because traditional structures, those walls, are created with some power imbalance. And so, when you are talking to a funder, usually I'm asking for funding. I'm not the one dictating the rules of this engagement, right? I need to get the funding to keep the lights on. And so, I think those things we need to start talking about.
I want to pull on a few themes because I have a funnel question for you all that is coming out of some of what you're talking about in terms of we've got lots of pilots, we've got lots of projects that start. How do we move from co-creation at the project level to a longer term ongoing co-creation as a foundational approach? So, you've talked, Rosanna, for example, about how we create something in the community, and if it scales up, it's removed from the community in some way. And Kate, you mentioned we need feedback mechanisms, but we need something beyond feedback mechanisms. There's ownership. So are there good examples, whether Canadian or even otherwise, how co-creation as a foundation can work across time, across funders and funding, and even across governments of different parties, for example? Because to be truly effective at a systems level, I would guess that we need to see something that is longer term and foundational. So we hear a lot about, oh, we co-created this idea, and then that's the end of what happens, and the idea kind of keeps going. Well, where does that co-creation relationship need to continue, and how do we actually support that?
That's such a good question. And one of the things that's a bit crushing about some of the projects that we often get involved in is hearing when we do collaborations and we hear from people with lived experience the comment, which is we've already said what we need. We've been involved in three or four of these things. and I don't mean these are projects I'm leading myself, but these are projects we're involved in. And it's crushing because it indicates a couple of different things. Obviously, the knowledge of somebody with lived experience, or the knowledge from a grassroots organization, is not persisting, right? So they're being asked again, what do you need? So that's a problem. And then two, it does lead to burnout. People become not necessarily as willing to participate if they don't see action coming from an initiative. And one of the tricky things I think about co-design, co-creation, is keeping track of all those asks and needs in a way that is meaningful and can be refreshed and can persist, so that people see their needs being addressed, or understand why that need hasn't been addressed in this particular phase, say. And it's a tricky one, and I would say it's not necessarily solved. I think there's an opportunity at this point in some larger scale projects, and this could be one of those projects where there's the opportunity to actually structure a system for managing and keeping hold of those needs, and making sure that there's governance around them, and that they persist, and that they're whole. There are some examples from Singapore where this is done quite effectively. There's digital tools involved in doing that, and participatory techniques are actually scaled in a much larger way. So that it looks very different. It's not necessarily a small group of people coming together to do participatory work towards an end goal. It's much more community or even region-based decision making. So this may be useful, but this is how I would respond to your question.
Uh, I'll let you jump in, Rosie and AKM, if you want, but I think that's a great example for us because our scale is quite large. If we're talking about newcomers, we're talking about a significant portion of our population in Ontario and beyond. And so to do this truly well, to co-create, we need that kind of scalable system, and also then that sort of ongoing persistence. So those are two really key points, Kate. Thanks for making. Rosie or AKM, did you want to jump in?
Okay. So, thank you. Yes, I'll not take much time because I know we want to hear more boundaries, walls, and all those things from Roji. An excellent example. Yeah, for co-design, what is the biggest barrier? Biggest barrier is confidence, is credibility. Who will design together? Power sharing, governance, sustainability of the budget. These are the key determinants for co-creation. So, what is the solution? Solution is that when we sit for co-creation, first, we must respect assets of others. For example, when I conduct focus group discussion, then I tell my team that, hey, the person we are interviewing is resourceful. They has the resources, they has the experience that I do not have. I want to learn from them, so I must respect. That is the beginning startup point for ABCD model, asset-based model. Respect the asset of others. Because Access Alliance, for example, have the grassroots approach to the community. Community trust us. Like the other day, Marco was conducting a community engagement group, and Marco told them that we want to introduce new programs, and if we encourage other organizations to introduce those programs, what is your opinion? Unitedly, they told all on a sudden that no, it is Access Alliance. So this is the trust that they trust that Access Alliance can do. So it is a small example in the whole ocean a drop of water.
Mm.
But I want that when we co-design, first philosophy is respecting others' asset and governance that is important based on the knowledge sharing and knowledge generation and knowledge synthesizing channel. And everyone should have the data power to own the data. The data is owned by the community from who we collect data. And accessible, we encourage peer researcher model that peers from the community should be in the data. They are the real owner of the data, and we are the user of the data. So that is a power sharing, governance, and these are the key aspects. And as you told, that sustained funding, that is very critical. Here people from Ontario Health are here. So I'm telling that for last couple of years, we are running from IRCC, not Ontario Health. From IRCC, we are running a program, settlement program for internationally trained researchers. The funded stopped in March. That gives us two messages, that all internationally trained researchers are already established, already integrated, no more further need. Or they are not a group to be addressed separately, but they are, because they have unique need that differs from other settlement needs. So finally, Rojit and Kate, I agree with you that this is the time we can make a co-creation working group. And I'm happy to say that Access Alliance can give you the platform for this. I see great people here like Eileen Hyman that Selima quoted her work. She's working for decades together on newcomers. I see Aija from the Leap. So there are great people from here. I see Cynthia from Ontario Health. So please come together. Access Alliance will offer you the center point for creating a platform for a newcomer health plan movement, not a project only, a movement. Thank you, Rojit.
Yeah, and I just wanted to tie it together a little bit. I think address Marco's question, which I understood it is, are there international or other regional examples of how co-creation leads to like sustained impact in this space is how so I'll address that question. And then I want to lean into a second piece that links to what AKM has said, and Marco, is how do we do this across our country? Right? Canada is a country built on newcomers. It's just you trace your genealogy back one or two generations, everyone is a newcomer at some point. And I'm like, I have this like existential crisis, right? Like, are my children newcomers? But my parents, like, when does it stop and end? So all of us are some version of a newcomer, I would say. And so having said that, first, there are wonderful examples. You don't have to look far. In the province of Ontario, we have now 60 plus Ontario health teams from the very rural parts to southwestern central Ontario. And these are like locally driven partnered partnerships. And I want to show how that mechanism of bringing multiple sectors to a system level is really important, and two very wonderful examples of how co-design has informed program funding, shaping, and collaborative work at a system space is East Toronto Health Partners, right in Toronto, and they've partnered with Thorncliffe Park, community health centers, neighborhood organizations to do co-design way before OHTs were a thing. I think the OHTs kind of solidified and formalized their partnership, but and also given them the resources to do co-design, to do exactly the pandemic response in Thorncliffe Park, and post-pandemic building up the social infrastructure and determinants to reach folks. Another great example is Midwest Toronto OHT. Same similar partnership, lots of co-design, lots of partnered evaluation. And those are wonderful models that lots of structural scalable lessons on how you move from partner co-design to really putting boots to the ground with a mind toward building a system where community voices and newcomers are placed equally as much as possible. How do we scale this to regional, national? Well, I think it's policy. Policy is lagging, right? So we know that health and settlement are already linked as determinants of health for newcomers. We already know that. You don't need another research study. It's kind of proven. You can't separate health and settlement as a separate in the newcomer well-being. But policy has not caught up to this evidence. So from a national perspective in a newcomer health strategy or platform, we need to bring policy to be, up to date and parallel the evidence. And so we need policy that needs to catch up and embed settlement factors into community health and accountability in a national framework, align with the strengths, building on what ACAM is saying. Asset-based community development is not, ignoring all the challenges. There are challenges, it's not Pollyanna. We're only going to look at strengths. We're going to talk about the challenge. It's not. It's being very clear-eyed and understanding what the challenges are, but really acknowledging that the strengths are already there. Let us not reinvent the wheel. Across Canada, across our province, great work is being done. What we need is a platform through policy and infrastructure to amplify those strengths. And approach it as a common health concern. And there's a lot of talk right now in political economic context of the economic prosperity of our nation. We are in different economic times. In the matter of last 22 months, we have shifted on many things. The world has changed, and economic precarity is definitely alive and real and present. And so part of the understanding is settlement and health and the social and structural determinants of health are essential to our economic prosperity and getting folks to understand that. We're not talking about charity. I think ACAM used that word, charity. And, this is something that we do when we have some leftover. This is something that's essential to our economic prosperity. And for that to happen, we need to have a national policy, regional, interregional policy perspective to support that.
Amazing. Kate, I see you want to dive in?
Sure. And I wanted to just center again the assets-based question or approach, because I think it points to a number of things. An assets-based approach to understanding governance and how it works at the local level, an assets-based approach to capacity building for co-design, perhaps, to create more flourishing initiatives at the local level. But I want to talk about why the lens on an assets-based approach is helpful to address Rosa's concern about barriers, because when we look at assets, it's a little bit like workarounds in healthcare. If a nurse is doing a workaround, they're doing it for a reason. And so the characteristics of the asset, whether that's a locally produced navigation role that is informal and done voluntarily, is signaling things. It's signaling gaps, but it's also signaling the solution. And so I think part of the role of a group that is coming to scale and think about much wider adoption and intersecting it with the policy level is to articulate that, right? To articulate where the assets are, what their characteristics are, and what they point to, both in terms of the gap and the piece that is how that gap was solved. So I really think that is the leverage point for some of the work that we could do to accelerate this. And it feeds into, why is policy lagging? policy is lagging because we rely on papers showing up in PubMed in order to be able to make decisions. And even then, after they've shown up, they may not be considered enough to make a decision. I mean, we've seen this numerous examples of this. Or we fixate on one article or a group of articles. So I love the health navigator role, but not every problem is going to be solved with a health navigator. Uh, so I would like to see a whole bunch of different versions of solving problems that are not the health navigator, but they're also present for policymakers in order to be able to get behind what we're doing.
So we've got about 8.5 minutes left, which is plenty of time to continue talking about some of this. One of the things that I want to move us to is based on what you said, Rosie, in terms of the policy shift. And it's related to what you're saying, Kate, about what I would call that academic publishing delay, where we wait for evidence instead of taking action. And so part of the shift for a project like this or an idea or a movement like this is that we need to help government move from this theoretical concept of social determinants of health and structural determinants of health to a policy mandate that they can fund. And it's a question for our breakout discussion folks to ponder deeply as well. But given that we know so much of what we know, and we know the audience we're trying to reach and their levers of power, and there are mechanisms with the OHTs, for example. So the structure is even theoretically there. What does that look like from, not every OHT is co-designing necessarily, but clearly some are. And there are examples in communities that aren't OHT, but predate them and are co-designing. What do we need to be able to show policymakers, funders, those who could invest in these kinds of solutions to make that shift into something that takes advantage of existing infrastructure to start with and uses it in a slightly different way? It's a big question, but I'm wondering if there's a sense of a conversation there.
So I've been doing some thinking about this because as I mentioned before, what happens often is we do these co-design engagements, and co-design might be happening at the grassroots without involvement of any external group collaborating, right? So what happens often is the data from those sessions, let's say there some kind of sessions or techniques that are being used through that process, they're somewhat invisible. And so there are ways in which to make that data visible. And I think that's an interesting option. I think using different approaches to gather evidence and describe and sort evidence is also something we could look at. There are realist and pragmatist approaches that look different. They still meet the evidence bar, but they allow evidence to be considered that is not necessarily generated through formal mixed methods, so they can be faster and more responsive. We see these kinds of techniques being used for more timely issues, right? So they tend to get used in shorter term health crises because the evidence is required. So I think there's some ways in which we can approach how we gather evidence, what we consider evidence, and how we tell the story of evidence. Because even though for somebody with lived experience, the truth is there in front of them, their experience is legitimate and obvious. It's right there, right? For bureaucracies and government agencies to be able to fund resources, they do need to be able to show data of some kind. And so I think it's also about using different mechanisms to make it possible for governments and governmental organizations to make those decisions.
And I think, this is a good kind of plant the seed for our breakout groups. I think so fragmentation costs the system more. We all know that. And it's interesting how in a democracy, because we live in a civil democracy, thank goodness, um, we have the government. Who is the government, right? And so there is a certain aspect of like citizen engagement and whatnot, but the government is not against anything, right? So I think this is also so where I'm leading in with this is whether it's the Ministry of Social Services, the Ministry of Immigration, Ministry of Health, Ministry of Housing, there's so many ministries in said governments. And then we have elected officials, and then we have, the people. And I think the real beast is everything is so siloed that the best intentions to care and do the best for everyone is impeded. And so I think the opportunity is to really look at and work towards a narrative that settlement and newcomer health and settlement, the quality of settlement for newcomers, is a priority that cuts across all ministries. I'm going to say that Ministry of Vocation, Employment, Education, Ministry of Housing, because I wear a hat as a nurse practitioner by training and background. And when I have a patient in front of me who is struggling to pay the rent, is a newcomer, is trying to get their credentials, and all of that is happening, the the asthma medication that I'm prescribing and diagnosing alone is not going to help. And so, if you just do a chain analysis, if we can just get the siloing across decision makers, and I think any decision maker would agree that settlement issues is an issue that is relevant to their ministry. It is getting that kind of narrative out. And I think as community-based organizations and social and settlement agencies who are outside of government structures, is to create those opportunities of dialogue to say this is an issue that is relevant to everyone. And then I would say it's too much of a burden to ask these small not-for-profit agencies to go head to head with figuring ministries out. And I think that's the role of government. The government needs to figure out how to work better, how to align better. And so that kind of upstream approach, that these settlement issues are relevant to all ministries, that politicians and decision makers reflect the priorities of their elected citizens, and that issues of newcomers and settlement is not an isolated area.
Thanks, Rosie. We've got 2 minutes left, so AKM, a minute of final thoughts from you and then from Kate.
Thank you very much. Yes, the discussion was wonderful, is flowing very well. Now, we'll discuss more and we hear more from all participants. And the discussion is not the end of the game. This is the beginning of the journey together. How we can overcome the bureaucratic friction that always I say, bureaucratic friction, that between ministry, if I have mental health issue, who will cover my cost? Health, primary health, mental health, social health, who? Between the ministries. So this is the time we need to create a newcomer working group that I give emphasis on a community of practice. Then we can design some policy, some framework, and that will support. Because as earlier, Duberelis, I think, has told that government has the intention. That's true. And academia has got the evidence. This is also true. And community-based organization, they have the connections. This is another true. But all truth are fragmented, as Salima said, and siloed. Now, let's join them together. And this forum This movement that we start today can do it a forum for Newcomer Health Plan. That's my last thing. Thank you.
Thanks, AKM. Final thought, Kate, and then we'll move to our break and then discussion routes.
So I think there's something about the design of this house and whether it actually needs to be a multi-family condo with a shared yard. So perhaps we'd think conceptually about how we work together and how we make this happen.
I love it. We needed a Barcelona model of inward-looking buildings with shared shared courtyards. Thank you, all of you.